path breaking or path making, trend setting, okay, or whichever. But one important fact about today's webinar is it's about AOMPT itself, that we are actually holding this course, the dry needling practitioner course at Chennai. And to make it more special and more interesting, the old venue, there were some issues with the logistics after they modified and restructured. So which made us to choose a better venue. So bigger topic, more on-demand topic. So we have got a better venue right in the center of Chennai at the IBIS Chennai City Center. Very beautiful place. And most importantly, that the menu for the buffet lunch, okay, including the non-veg. So all varieties, everything. So most importantly, when we come to this invasive methods of manual therapy, okay, we tell manually means it is by hands, and later it expanded to use of the tools like cupping, like instrument assisted soft tissue mobilizations. We also explored like how a functional neuromuscular stability training can be incorporated with manual techniques. So it can be even the mobilization with movements or the belts, the TheraBand, that can be applied together with the myofascial techniques or articular techniques or neural techniques. There's nothing we did not actually explore when it comes to the courses of the AOMPT. The participants of every level, whoever are doing our offline courses, especially because many of the participants believe that offline is the only way to learn. So there, of course, that's the majority. Everyone cannot be our committee members who are actually knowing that if you really want to learn, you can learn online also. And most importantly, the teacher who considers as a medium of knowledge or servant of knowledge, if I have to teach, means I will teach offline or I will teach online, I have to teach. Okay. So that is the desperation, which is both the sides. One is the teacher side, other side is the learner side. Teacher as a learner to get the inputs back from the participants. Learner as a teacher by contributing, taking more webinars. So it has been a two-way process, which has made the academy to explore the best of every course for the benefit of the patients. Although we have conducted some of the theoretical or introductory webinars before, this webinar is a very important one because it is taken by our own president, Ritu Sahni ma'am, who is personally a very big fan of dry needling. In the sense, you put the fan, you feel dizzy, you collapse, okay? So the needle phobia, okay? So that is the living example. And madam is actually now taking up this topic. And she has also ordered the needles, okay? So it's going to reach her on the day of the workshop, the morning. So we are actually looking forward this session more than any other session. And Shaitab sir, of course, is taking the technical part of the needling in the workshop. Whereas the clinical part of the physical therapy side, how we make the decisions and use the needle, that will be, of course, by the content moderator. So where I am there. And the next is, when we see here, when it comes to theoretical part, there is no other person to match the efforts of our Ritu ma'am. So definitely it doesn't matter whoever is the resource person for any workshop. When it is a course of the AOMPT, always the background knowledge to make the participants of the course to get the depth, what is called as like invasive manual therapy, invasively to influence them, okay, to inspire them. So that is the PowerPoint presentations and lecture masterclasses and webinars of Ritu ma'am, which is always like the kickstart. Okay, so it gives the start to the participants to actually engage themselves in being focused in the upcoming course. Okay, so then only they feel that moment I announce Ritu ma'am's webinar, then only people feel that yes, the course is really coming. Okay, so that feel is coming, the feel of the course. So it is like that. So we'll go on with this beautiful evening session where we are going to see the dry needling principles and practice by none other than Ritu Sahni ma'am. And we'll move on to it in a while when this second part of the recording starts.